Well, hello there, everyone. Stephanie Halvick here of RN Faces, and I think you're in the right place if you want to be here for the ultimate guide in treating skin tags with the Skin Classic. For all of you great estheticians, skincare specialists, whether you're a newbie or a veteran to the Skin Classic, I think what you'll find in this video today is just what you needed, especially if you are new and you just don't have that extreme confidence yet. Well, let's get you confident on identifying these skin tags, making sure that when the client leaves their office, you're going to feel so confident that when they come back, those skin tags are going to be a thing of the past. Maybe you're a veteran and you want to pick up just a few little helpful hints, or maybe boost your marketing campaign for the Skin Classic, your confidence. Maybe you want to be the skin tag king or queen in your area. And lastly, we know that we want to make a lot of money in our offices to support our families and our lifestyle. So this should help with that. So, and you know what? For those of you who don't know who I am, I'm Stephanie Halvick. I'm a registered nurse, owner of RN Faces and the Skin Classic. And I love supporting my Skin Classic providers with trainings to help them along and make their Skin Classic journey a terrific one. So, you know what, I want to kind of power through this because there is a lot. And if you do, hey Brenda, if you do have questions, please do not hesitate to pop them into the chat box. Let me see if I can see all who's here. And if you have any questions, and also let me know you're here, and give me a thumbs up if you have a Skin Classic. I love to see the Skin Classics in progress. Anyway, so here we are, just another training for the Skin Classic to the rescue. And you guys know that I love skin tags more than I like a lot of things, but this is a great little picture. It looks like a heart. So if you want to snag that up and use it on Valentine's Day, please go ahead. But there's really nothing that we love about these skin tags except for us that treat them. Okay, so let's get down and dirty. Let's figure out, if you're new, if you're not that new, but maybe you didn't know the difference between skin tags, moles, and warts. Very important, because we do get a lot of providers asking questions. Hey, what is this? They'll take a picture with their derm light, and we'll get to the derm light in just a minute or so. And it doesn't always, there's ways to differentiate skin tags, moles, and warts with even out a derm light, but that is the ultimate. So if you guys have a derm light out there, raise your hand, let me know. Give me a heart if you really, really love it. Anyway, so let's do this. Skin tags are surface. They're epidermal. You'll have moles that are deeper into the dermis. They have a blood supply, and warts are also deep. So those deep things we are not treating with the Skin Classic. That is a medical type of a procedure. Skin tags are very soft and floppy. You can kind of move them around, where moles are fixed to the skin and warts are rough to the touch. Not to be confused maybe with a keratosis, and we'll talk a little bit more. Skin tags are not contagious. Moles are not contagious, but warts are. You generally won't have hair growing in a skin tag unless the client was super hairy in that area and they developed skin tags. Moles, sometimes you do, and sometimes you don't. And warts, you don't. Skin tags appear in areas of friction, moles in areas that are sun exposed and also not sun exposed. And the warts are usually in thicker areas, like the palms of your hands, the arm, where it's a little thicker skin. Generally, not too many on the face, but occasionally we do get some filiform warts, things like that, that may appear on the face. And skin tags are caused by friction. So you're going to see where we develop those under the arm, in the crux of the neck, in the groin area. And moles can just be anywhere. And a wart is caused by a virus. So the skin tags are going to be the same color as the skin. If you're a dark skinned client, they're going to have dark skin tags. If you're light skinned, they're going to be light skinned. They're generally the same color of the skin. Moles can be lots of different colors, clear, brown, even like a blackish color, where warts are white or colorless, if you will. Let me just see here. So this is the derm light that I talked to you about. And I know that a lot of you out there have a derm light, but for those that don't, and you know what, let me shrink myself here. Good. So for those of you that don't have a derm light and you're using some type of electrodesiccation in your practice. Hi, Susan. Oh, nice to see you. And you want to be more confident, you really need to get a derm light. I don't mean to sound like a used car salesman, but if you don't, go to my website. I always have them on sale and we really need them. So let me show you what the derm light can do for you. And it's always included with your Skin Classic when you purchase it from us because it is that important. And so we'll see some certain things. This is a flat hyperpigmentation, but it looked brown, right? That is what you would see. That's very helpful. And you can see those capillaries in the dermis that we don't treat. This is melasma, something we don't ever treat with the Skin Classic, but we need to know what it is so that we don't. It is a contraindication. Here you've got a mole. You can see the tiny vessels, a keratosis, which is treatable with the Skin Classic. Only vessels you're seeing are in the skin, not the keratosis. This is a clear mole. We shouldn't treat anything that has a blood supply like that or this if this is becoming helpful. And that's just a fun picture of a clogged pore from Patty Booth in Florida. Thanks, Patty. So it is really helpful to have a derm light. Now, some of the skin tags that we're going to see need to be seen by a physician. Your regular old run-of-the-mill skin tags, small, large, are very easily treated in the offices of estheticians, nurses, doctors. And if you come across one that's aggravated, bleeding, or black like this, please do not start to treat it. Make sure that they do see a physician because something's not quite right. And we don't know what it would be, and we don't want that to fall on us. We don't want to treat anything that's medical. So if something's irritated, itchy, those are the things we're not going to get involved in. We are here for just the cosmetic things that we see normally on our table every day under our mag light. This is what a wart will look like. So with your derm light, this is really fun to look at. You can see the characteristics of all of the little fingers coming up. You'll see it in here as well. So if you're looking with your derm light, it feels rough. Well, right away, that's a pretty good giveaway. But if they have all of those forms, almost like coral under the sea coming up, but not like keratosis, more like little fingers, then you could assume that that would be a wart and you don't want to treat it. This also is a wart, and we talked about how they can form on the thick parts of the body, like the hands and all, and they may even have little speckles of red in there. So we stay away from those things. They're very painful. They're deep. They won't be completely treated with a Skin Classic. So again, know when to refer to your physicians so that they can treat these clients. They're a virus. You don't really want that in your office. See how all those little forms come up real nice? That is a really great picture with a derm light we took during a training. And again, with the derm light, there's a mole, so it's fixed to the skin, and you can actually see those capillaries right in there. So that is an awesome picture with the derm light and a clear mole. Some people might think that maybe that was a sebaceous hyperplasia or a clogged pore, but it's not. Look at the blood supply there. Now, for you newbies, I know a lot of you out there charge differently, and I have a lot of my Skin Classic trainers don't always charge the way I do. So you want to develop your own way to charge your clients for skin tag treatment. So I think it's easy like this. Think of it like $25 per irregularity. And if you have multiple imperfections, you may give them a bundled price. Maybe they came in for an eyebrow wax and all of this, or a facial, and they have a lot of skin tags and they want treated. You can give them a nice bundled price because they're already doing a procedure with you. Or if there are a lot of little skin tags, you can still give a little bit of a discount because $25 per irregularity between the large ones and the tiny ones. You can kind of figure that out. I have a lot of videos in our special group, Thermolysis Skincare for Estheticians, that talk about pricing. I don't like to do it by time because this treatment is very quick and you'll be done sooner than you think. And I like to treat in zones, like either the neck, décolleté, the face, or the hands, that type of thing, and do that as a full treatment then. So just work out the way you like to charge, put it in black and white, read it over and over to yourself so that when you're talking to your clients, you're not hemming and hawing like, I charge like 25 per. And no, you want to be very succinct and you want to know how to do this. I'm going to show you right now how I go about how I go about a good consultation. I'm going to narrate this. So this was a lovely client of mine, and she came. She had a neck full of skin tags, and they were a lot of them. But I didn't go in for the kill and go right to the skin tags, right? I started at the forehead. Zoning your client is very important. There may be things on the face that she would love treated, but she didn't even know. So I go through like a forehead, down the side here. I point out maybe any little cherry angioma. I do it with my Q-tip. I like to point with that. If you have a new client, you don't want to be stretching and pawing at them too much. They're new people, but like you need to stretch a little bit. Maybe you need to feel a little bit of the keratosis. You need to see if something is raised or flat. If you're ever asking me through Messenger or in the group or any one of our terrific Skin Classic providers in our group, please make sure you say, this is a picture of my client and it is raised. She's had many of these for years. Take a picture with the derm light too. Please just don't pop up a picture of the derm light. It doesn't help anybody out. We need to get the full context when we're looking at these. Again, we're not diagnosing, but we know what a skin tag looks like. We know what a mole looks like. Now I'm getting down and dirty to right where she really wanted her treatment. So I tell her, oh, there's a floppy skin tag. Here's another. Here's another. And as I start pointing these out like a rapid fire, she's realizing that she's got a lot of these skin tags, which means she knows it's going to be somewhat probably expensive. But that's where I can always allay their fears. Okay. I charge $25 per irregularity, but let me go through and when I get like the total number, and I don't count up to like say 50, but they can tell when I say, here's one, here's one, here's one, another one, another one. And then when I say, based on the amount that you have, there's probably about 30 little skin tags there. I might say, at $25 per irregularity, that would be like well over $500. I would like to bundle this for you today because some of these irregularities are much smaller than the others. So I think $350 would be a very good price for this. And then in a month to 6 weeks, I would love to see you back in the office and I will look at everything I treated. And if like that bigger skin tag still has a little remnant, I'll go ahead and take care of that for a flat fee of $25. This way, your client feels confident that they can come back, get a little touch up done, not break the bank, and know that they're going to be happy and you're going to get your great before and after photos, which will boost your confidence. Once you develop your own photos, you can use all mine that you like. You can use all the video that I have, but you definitely feel confident when you see somebody with a neck full of skin tags and you've already done that and you've got the pictures to prove it. When you talk to that client, you might say, yes, this was a client of mine, and this is what you can expect. You also can use your before and after book, but it will boost your confidence every client that you do if you've done it and documented it. Um, let me get on here. So now we don't want to remove. And for all of you out there, I still get the people that message me, Steph, can I remove this? You know what I really want to say, but I don't. But no, you cannot remove it. And please take it out of your vocabulary. Otherwise, we'll start sounding like junior dermatologists. People will be looking at us like, what the heck are they doing? No, we're using direct high frequency to dehydrate a skin tag. Now, it's not cautery. So for those of you that use things like, a superficator, a Bovie, things like that, you are going to get that like barbecue smell. It's nasty in your office, and you're actually charring the skin, which in turn means that you need to treat that like a burn. And that's like with a salve or an A&D ointment or bacitracin. Now, with the Skin Classic, this is ideal because we are just dehydrating these skin tags. And therefore, when we're healing or we're going through that process, we treat it like normal skin. It's dehydrated. We're using our gentle cleansers, our gentle moisturizers, period. No ointments at all. So it couldn't be that easier to do. Now, I want to show you how you can dehydrate these. And as you go in, you'll see that we moisturize them with a little witch hazel that helps conduct. And we're touching and holding a little bit longer than maybe sometimes you see. And I will say, back in the day, I think I have a video here from maybe 12 years ago that I tapped it a little faster. Yes, you can get to the end point, but I think when you tap slower, you're going to get a better dehydration, so that may take care of that irregularity like that. So that's just been my experience, and I want you to learn from my experience too. Yes, like this one. I want to show you that, yes, you can do this. And you can see how quickly I am treating this. I don't want to treat it that quickly normally. Hey, Nancy. So I want to hold it a little longer, but I did this back in the day. I see some of you guys do it too. Not a big deal, but just treat them a little slower, and I think you'll be a bit happier with your results. And yeah, that was about 13 years ago in La Vida, Colorado. Okay, so let me move on here. And yes, you can do the same process with something this big. This video is in our group circulating as well. But now this nice lady, I think I tend to burn up this video a lot just because I think I'm just in love with what happened here when I was training Loretta Kent down in San Antonio, probably 13 years ago. And she's now one of our awesome Skin Classic trainers. But this nice lady came in with so many skin tags on her face. And she was so happy when we got done with her. Now, I will say Loretta had a physician in her office, so she removed some of these skin tags, and there are videos of that in our group. But for the esthetician or nurses not working with doctors, please, you can still dehydrate, and you're going to get the same exact outcome. But when she was done, this was 1 week later, She was totally thrilled. Her husband actually broke down in tears when she came out of the waiting room. Oh, yeah, it was 2013. So that was an awesome day for the Skin Classic. You can work around the eye. If you're new to the Skin Classic and you come upon something like this, just know it can be done. But if you're not feeling too confident about holding an eye still, then you can pass on this. There's nothing to say that you must do it. So you want to work in your own comfort zone, and eventually you will be doing things like this. And this was a nice young lady, but it was floppy right on her eyelid. And this was from the aesthetic medicine office in Bozeman, Montana. I had the pleasure of treating and training those nice people up there a bunch of years ago as well. So let me. And again, oh yes, and so if you saw my training video in our group, Thermolysis Skincare for Estheticians, I think I popped it in there just yesterday. This nice man. Now, see, this is what we're talking about. This is how we make our clients super happy. So you can see the skin tags on the left, his skin tags during the treatment. You see how they blossomed. They looked like they brought all the attention to them. But within 7 days, they were gone. And he was ecstatic. And sometimes your clients may tell a story like he did and say to me, he was just at the dermatologist before this week, because you could see on his before picture and in my video that he had had some cryo done for some keratosis. And he asked his dermatologist about those skin tags. And the dermatologist said he could, politely said, he could send him to an ophthalmologist who could inject lidocaine and cut those out. Well, that was music to my ears. And this nice man is a fellow Rotarian. So I was so eager to help him out. And look at him. He just looks great. Again, another great day for the Skin Classic. And this was, I'm just going to show you one eye because this is in our private group. So you're
I'm just going to turn your head this way.
okay. So I hold the eye nice and still. And again, if you're comfortable working around the eye, so be it. I did numb this gentleman's under his where his skin tags were. So I did numb that up. So I say 99.9% of the time I don't numb anyone. Well, this was that like 0.1%. So and you can tell he's actually not uncomfortable at all. And you can see the video in the group where we're talking. Each side probably took maybe a minute or so to do. So you might even say to yourself, okay, what would I charge for something like this? When we say $25 per irregularity, but you know what? You're working on a very sensitive area. I did go ahead and numb him, and there were two of them. So I think $100 is a really fair price for this, and it worked. So he was very happy. So that's the other thing too. You want to make sure that they do come back and do this. Good. And so, okie dokie. And guys, if you have any questions, you can drop them in the chat box. I wanted to show you this video because it treats a lot of skin tags, right? So this is how fast that you could be working. Those are, and you can maybe increase your screen so you can see the tiny ones, but so they're very tiny, right? Some people come and they might have like 50 of those things. Well, because they are so tiny, you're just basically touching, tapping, and then you're just moving on. And you can get through a full neck like that very quickly. You just need to move quickly, and you'll see how quick this is during a training. So you'll see how quick I have them moving. And for you seasoned Skin Classic providers out there, you probably would move even just a little quicker. I'm the trusty assistant with a swab of witch hazel to help conduct, and it's also a cleanser. But we go ahead and I like to alcohol the skin before I use the Skin Classic. So now I try to be methodical, right? I like to go from, say, the back of the neck to the front, so that I don't miss anything and so that I don't overtreat anything. So yeah, you could see now. See, she's going from one to the other to the other to the other, and it's just a quick progression. For those of you that have the Skin Classic, I'm sure probably by now you know that we do have a Skin Classic Masterclass. And in that Skin Classic Masterclass, when you join, and it is for Skin Classic providers that have been trained with us, you will see in the guide section, like there, that there are little videos, quick videos. So say, you haven't treated skin tags in a while and you want to see a couple little snippets, just like a few of these things that we've seen today. Pop into the guides and then you'll be able to see them. I try to add more and more to them and keep them down, from 2 minutes and under, so that when you're in a hurry and you want to see something that you need to see, you'll be able to pop right in. So, Skin Classic Masterclass, private group for the Skin Classic providers. Pop in if you like. Now we can even talk about the skin tag. So you're new to the Skin Classic and you say, well, geez, I know the Skin Classic people are always saying, don't treat the legs, don't do this. Well, you know what? Skin tags can be treated pretty much anywhere on the body. There's no real wrong way to do that. But as a provider, doing any procedure, you must take into consideration your client. Do you have the correct client for this procedure? Yes, she may have a lot of skin tags under her arm, but maybe she is a cross country skier and she's not going to stop. She can't stop. She's in competition. Whatever the excuse is, when you get people that have skin tags in utterly all the wrong places, make sure that you get lots of good information. Like here's a skin tag on a tattooed area. Now, the skin tag came after the tattoo, obviously, but yes, you can shrink this and it will fall off. Now, if the tattoo underneath manipulated any of the pigment, then yes, it may distort it a bit. Typically, like cherry angiomas, anything that's in a tattoo, it's epidermal. So the pigment is dermal, and usually tattoo artists are going even a little. They're going into the dermis. They use more of a jackhammer, a coil operated machine. So I would dehydrate this for this nice person and know that even after it healed, if there was lack of pigmentation, it wasn't because of what I did. It was because that the tattoo kind of stretched that area out and the pigment as well. So it's not a contraindication at all for a Skin Classic. Now, we have many women, and then in the summer, it's hot, it's humid. They may have a lot of, say, skin tags or keratosis under the breasts. Now, it's not a contraindication for me. But if my client's a hot yoga instructor and she, I know she's not going to have a favorable healing, meaning it will heal terrific if they're kept dry and hoisted. So I know that she will get a great result. But if I choose the wrong client that's a runner and she's still going to run, well, I know that very first time she runs, they are going to look beet red. They're going to be so excoriated, and then they're going to weep, and then she's going to be unhappy. So sometimes it pays to put these things off in other times of the year. It just depends. But even like this nice man here, His skin tags, obviously, I salivate when I see those kinds of things, but I might put him off if I find out that he has something with limitations to his job or something that are going to keep him from healing nicely. And you may ask, well, can they put a Band-Aid on it? Band-Aids don't work well with humid areas, in areas that have folds, because it gets wet and then they slough off too soon. So occasionally I may let my client know they can use a little cornstarch. If I've had state troopers with high collars and skin tags, not a great fit, but I did it anyway because he said he would keep it nice and dry. He did, and he did use a Band-Aid just when he was in his shirt, and it worked out great. So sometimes it does, sometimes it doesn't. So you have to evaluate your client, and don't be alarmed when they do look excoriated, because that's just the way they're going to get. This is a keratosis, but I wanted to show you this photo because this progression, because this is a nice client of mine. Thanks, Jerry. A nice client of mine, and she'd been a model for us in some classes, but I never did her keratosis. She didn't want to have it done. She said, no, 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 it's a mole. Well, I knew it was a keratosis, and I'm not going to push her. But eventually, after she had other keratoses go away, she goes, yeah, okay, Steph, I think you're right. So I treated her keratosis. You can see she's fairly well endowed. So again, selecting the correct client is important, or at least giving them the best options. So when I treated her, I did tell her, Deb, when you go to bed, please try to sleep with your bra on. And it's not always so much about when you're sleeping, but it's when you get up without a bra. So I don't want the skin hanging because it can get a little excoriated looking. And sometimes we've had some large cherry angiomas, and from the pull of it, then it can increase the heal time, and sometimes leave a mark because you're stretching and you're maybe laying down a little scar tissue. So, but I wanted to allay your fears here, because the middle picture was like 2 weeks after she, maybe 2 to 3 weeks. And I knew it was going to get better, but of course I am concerned. And when she came into the office, which was about 2 months later, there she was, a huge improvement. She still had a little bit of redness, which she didn't mind. So, we strive for not perfection, but improvement. So make sure you think about those things when you are working with your clients. And Jen Harris had a little trouble joining. Okay. Would you go over aftercare and follow-ups? Okay. So aftercare, always wash gentle with fingertips, pat dry, and use a gentle moisturizer. No actives like retinols or anything like that. If we've treated a lot of things on the face, like a lot of sebaceous hyperplasia or a lot of cherry angiomas, I like for my clients to wash gentle with their fingertips at the vanity and then shower with their back to the water. That will make it so that even if a little bit of water runs onto the face, it's not that big a deal, because then they'll pat it dry, put on their good moisture, and call it a day. No salves, no ointments, none of that. So we don't want to do that. Thank you for asking that question. Okay, so some large skin tags treated, right? We've had the small ones, we've tapped slowly, we've tapped quickly, got to the same endpoint, because I always say there's more than one way to skin a cat. So even my providers, my trainers, they develop their own style. So it may not be exactly like mine. And I have about 35 trainers. So we all don't treat exactly the same. We all don't charge exactly the same. But these videos that I've created, If you watch them and you develop these habits, that's great. If you have your own little way of doing it, as long as it's not dangerous, then I'm all about it. So here are a few large. And so you can see where we touch, we hold, see that nice hold in the center, and that just really dehydrated it almost completely. So, and look, here's a floppy one, right? So hold it longer, touch and hold it, hold it, hold it, hold it, keep holding. Okay, you can see how it's dehydrated. Again, hold it, let it dehydrate. See how that's all really changing. And so, with that said, you won't be tapping as much. And once you start dehydrating that from the inside like that, the clients become much more comfortable. It dehydrates that skin tag, which dehydrates any little nerve endings. So, and again, there's no cautery, no smell of flesh burning, just dehydration. And I know this client healed up pretty quick because I think this might have been your client, right, Brenda, when I did your training? Anywho, so yes, I could watch this all day long, but I know we've got things to do, right? Let's see here. Okay, so then we come to some of these where they're in all the wrong places. But now, a lot of you out there, estheticians, you do a lot of Brazilians, that type of thing. So you may be very used to working in that area, and your client may be more particularly good about aftercare, about maybe applying a little bit of cornstarch. But the one thing I really caution you about is make sure that you are differentiating skin tags and warts, because many, I've had this happen in a training where one of my trainees was covered in venereal warts, thought they were skin tags. So I had to tell her that the best practice for that would be to see her gynecologist, because they would need to be frozen. And you know what? They would be super painful to do. So if you do a lot of waxing, start noticing the skin tags, more floppy, right? There may not be, if they're young, they won't have that many of them, a couple perhaps, but it's very important to differentiate between that. So make sure you take a little bit more of a look. You can look with your derm light and you'll see those wart-like characteristics with it. Like probably the one on the right is the one that I have seen mostly in that area. These other areas, on the hands, the feet, the back of the arm, the knees, those types of thicker skins, this is what they tend to look like. And so if you can kind of look at those, remember those. Here's a very large skin tag that we had in our group. And so the provider was a little nervous, right? After the client, takes a picture and sends that back. Why? It's healing, but the skin tag fell off. It may have fallen off a little premature, and if your client is more dark skinned, then when that skin tag falls off, you're going to see more pink skin, which may make anyone nervous. But as the skin heals, and because it came off too soon, maybe rubbed off from friction, it created its own little wound that didn't come from you. It came from the friction afterwards. So, like that, it will start to close up like a wound. Anybody out there that's ever done wound care on ulcers, maybe home health, anything like that, sometimes it takes a little time, but everything heals from the outside in. So you can see how beautiful it healed up. Yes, she had a little pink mark there, but other than that, she was fine. So those kinds of things do happen to us. And you can always ask in our group what we would do. Yes, just like this one. This was a very large skin tag under the arm, almost to the breast. And this too would be okay to do. Actually, this was done, and it was when they dehydrate, they become very hard. So that's not a big deal. They just need to keep it dry, keep it away from friction, and it will probably fall off. Maybe need a second treatment, maybe, just a little touch up, but usually not. And sometimes this was on the waistband of somebody who had a skin tag. So this is super normal. Wouldn't you think that wherever your waistband would be and you had a skin tag there, after it's treated, it's going to develop friction. So the client will get something like that. And we have a few of these pictures in our before and after book. So if you're doing consultations, go ahead and show them, look, this is an area of friction. It might look like this, but it's perfectly normal. And if you have any questions, you can message me. But this is what you can expect if friction continues and you get it wet, maybe in a hot tub kind of a thing. And for those of you that do remove skin tags, I have nurse practitioners, doctors, plastic surgeons, some dermatologists with the Skin Classic. And if you need to train your staff, here goes the removal of a skin tag. And I think I'll narrate this. So this nice gentleman's been in a bunch of my videos for a lot of sebaceous hyperplasia, but upon finishing up his treatment, probably about 15 years ago, I asked him if he had any skin tags, and he said, yes, he did. So we got out our tag probe, our Skin Classic, and we set it on 30, I think it was. And there we go with that beautiful tag probe. And this was the old model. You'll see, oh, maybe you won't see it. But so look, it was a fairly large skin tag. So I'm going to use a pair of Dumont tweezers, pointy end tweezers. But if you notice, when I go to grab the skin tag, I put those points out in front. I don't want to grab it with the point. And if you look at my probe, I am only using the very tip, not the sides. It's not sharp like that, just the very tip to create that current to treat it, remove it. And so I have to constantly distract it so that I make it easy to get through that tissue. And if you notice, no bleeding. And there we go. So yes, you can remove them with the Skin Classic. Do I advise it? No, you don't want to do that because you could get in trouble. Oh, that's when I had a 1-800 number. Let me see here. I think we have a few more. So I hope that's helpful. And, a lot of these videos, if you want to see them in their entirety, I have a YouTube channel's got so many quick videos, longer videos, more training videos. Now, this is a nice lady who had a lot of those skin tags, just like Kenny's, but I would have just dehydrated those. Dehydration works. Don't feel like, oh, I want to remove them. Don't do that. Just treat them and they'll be just fine. They'll fall off just in 5 to 7 days. They're going to look just like the ones that some people would remove. Okay, so let's talk quickly about marketing your Skin Classic. Now, sometimes I get a little bit of flack for this, but I have the esthetician and the nurse, and I like to talk to my clients in really good terms that they're going to know what things are. People sometimes don't know what a cherry angioma is. I'm going to say a cherry spot. They don't know what a lentigo is, so I call it a brown sunspot. They don't know what keratosis on the face for DPN, dermatosis papulosa nigra, is. So I call them Morgan Freeman spots. And, my clients get it. They know what I'm talking about. So that is one way to do this. You can snag these in our group, Skin Classic Media, but you can also go to my page and get them. And we also, in our group, Thermolysis Skincare for Estheticians, and our Skin Classic Masterclass, you can learn how to create a Groupon. Groupons are great for skin tags. No other modality in your office would I use it for. Only skin tags. Your probe is $1. You're going to upsell your clients. They come with many skin tags, but they've only Grouponed for up to 5. So you can have your client treat all of the others at your price. So that's the reason why I like it. If that sounds like a good thing to you, please go ahead and make sure that you view that video in your manual. You will learn a lot, and many Skin Classic providers are kicking ass with this Groupon. So many reasons why, but you have to go to the video. Some of these things, Grandma, you have got a Rice Krispie on your neck. So these kinds of things you can snag from us, put them on your social media. Grandpa, do you know you have a Cocoa Krispie on your neck? Those kinds of things are attention getters. So besides the before and afters that you should be using in your social media, like you saw those pictures of the social media posts from our great providers this week in Thermolysis Skincare for Estheticians, that's what you need to do. It's not that hard. You can snag my photos. You can snag my verbiage. I don't care. You could be a copycat so long as you are a Skin Classic provider. Also, I do videos on how to have a Skin Classic party. I had my latest one, a sparty. So it's very easy to do, lucrative, quick, and you'll have the men and women coming to you. I love doing mobile services. I talk a lot about that because the Skin Classic is very small. So it should go with you if you are able to do mobile parties. I have a few mobile events coming up myself. And so I'll maybe even try to get some live video in there. So there are a lot of things. And yes, I have these like on my Vimeo. You can go to RN Faces or Stephanie Halvik. I have a lot of good training videos. And one other thing, if you are new to the Skin Classic, please don't ever cry to me that you're not busy, because what I need to show you is this. If you're new to the Skin Classic, please make sure that you have this question on your questionnaire. Look at it. Are you bothered by any of these issues? Skin tags, broken capillaries, cherry angiomas, yada, yada, yada. Whatever procedures you are keen on doing and you want your clients to know that you can help them with problems and you can solve their problems, because this is where I put their problems: hair loss, sebaceous hyperplasia, blotchy skin. All of those are problems. And once my client checks off one single thing, which it's never one single thing, it's my obligation to talk to them about what it is I can do. So when they say skin tags, acne scars, hair loss, I go right into full Skin Classic mode for their skin tags. Maybe I will talk about how I can help them with Dermafrac and their acne scars, hair loss with Dermafrac and my Definage serum. So see, once you have that, you have to talk to them. You don't want them guessing what it is you do in the office. Make sure they know. Now, this is also something that you should have on your intake form. And if you are new to the Skin Classic, do not pass go. Do not do this, okay? This is something has to be done. Get a client updated intake form. So this is what I have. Mine is an updated intake form for 2024. I don't care if you just opened your practice 6 months ago. You're going to create a patient or client intake form or an updated intake form. And so You're going to ask questions like what kind of medications they're on, but you have to put this little blurb in there and have every single client that comes through your door for an eyebrow wax, for a Brazilian, fill out the updated, it's only one little sheet, updated client intake form. This way, you can talk to them about the procedures that you want to do most in your office. If you're new to the dermafrac, many of my clients are dermafrac clients. Now, why wouldn't you put on your form what issues bother you? Acne scars, hair loss, blotchy skin, fine lines, fine wrinkles. When they check those, then you're obligated to talk about how you can take care of it. So it's just as easy as that. I would practice that if I were you. It's easy, I say it, but that's any new procedure that I've ever done is something that I go over and over and over in my verbiage. So I might be driving along in the car or pretending to do a consultation on people. I did that for many years. And yes, Susan, you are right. I guess, I have so much of that Morgan Freeman stuff out there in the world, but I've never had anybody call me out on it. I haven't made up anything lately, but I'll have to look more into it. Well, I guess we could just call them DPN. And then we could always say, well, dermatosis papulosa nigra is in the keratosis family. And if you can imagine someone, like Morgan Freeman, do you know someone that looks like him that has those spots maybe under the eye? When I'm referring to a Fitzpatrick scale, I generally say Nicole Kidman, as being my Fitz one would be Nicole Kidman, that type of thing. So maybe, saying something like that, like Whoopi Goldberg is my go-to for the highest Fitzpat. So that's how I would definitely handle that. So, okay, so we're done with that one a little bit. Let me get rid of this and see. We're just about finished here. And okay. And so many of you that are watching right now, if you do have a skin classic, give me a thumbs up. But if you don't have a skin classic, you've been eyeing it up this month, please do me a favor. You can snag this QR code, or you can simply go to my website, RN Faces. Until Thursday this week, I have the Skin Classic payment plan available, $2,000 down, $200 a month, and that does include one-on-one training in your facility, that derm light, that before and after book, the probes, everything you need to really get started and know that you have my full support, the support from my great providers out there, my great trainers, everybody that posts their videos, their wins. So I love all that. And so if you want to be part of that Skin Classic family, by all means, just go to my website or get that QR code. And, today I'm on a few different platforms. I am on Instagram, LinkedIn. I'll be on TikTok later, and YouTube. So you'll see these live trainings on those platforms too. So if you can't make these all the time, please don't worry about that. But when I go ahead and schedule those, hit the going button, because after the broadcast, it will take you to the replay that you can watch at any time. We're all busy. Watch at your own leisure. And if you ever have any questions, guys, then by all means, just let me know. I'm here for you. And if anybody has any questions right now, I hope that was informed. Oh, thanks, Jerry Sue. Yay, yay. Jerry Sue has two. She won one year too. How about you, Jerry? Okay. Well, everyone, thank you for watching. I really appreciate the support. And if there's anybody that you know would love a skin classic, be sure that if they really want to know if they want one, they should watch one of these videos to see if it's something that is right for them and their practice. So have a great day, everyone. I'll see you at the next training for this summer. Bye-bye.